Hey, it's Dr. Melanie Petro, and we are going to go through our employee Botox video and explain what I'm doing. So this is Reagan. She's gotten a lot of criticism for people think she had too many units. I can tell you that is always, it always changes. And what she doesn't want is for the forehead line that you see me injecting to end up dramatic, much like her head motions, because it doesn't hurt that bad. But I'm keeping that line at bay. So when you move and make creases in your forehead, then you're atrophying the collagen underneath. So this is preventative for her. And it's going to keep her skin as smooth as it is. And then she moved one other line. So those are micro amounts. And this is VZ. So VZ's forehead is bigger. She just has a bigger head. I've done her forehead. Again, the pattern's always different. Now we're going to do in between her eyes. As you can see, her left brow is a little bit lower than the right. And that muscle that she's squeezing pulls her brows in and down. So the Botox is going to cancel out that muscle and then allow her to have some lift, which is going to create more light under her eyes. And most importantly, get rid of that line and keep her from getting older and then having a big crease in her head forevermore, which is not good. I'm not sure who's coming up. Okay, now her crow's feet. So that muscle, if you ever feel like your eyes close when you smile, it's because, and it's going to lift up just like I did with my finger. So if you feel like your eyes close when you smile, which that little muscle is designed to do that, you can relax that muscle, leaving the lateral part of your forehead so that you can get some lift and have more room to fit your eyeliner. Squinting causes those lines, so the best thing you can do to prevent them is definitely going to be sunglasses, and then Botox is a close second. So wear your sunglasses, always use sunscreen, but there are lots of ways, especially when you're young, to keep yourself from ending up with lines. Those are the bunny lines. That just narrows the nose. I think that's VZ's favorite. She has a vendetta against her cute little nose, and she scrapes it with exfoliants, and she definitely believes she's kept it smaller. Here's Jan. So this is Jan. She's had it in some places, and now we're doing around her lip, her neck. The depressor anguli oris. So that's a muscle that pulls your lip down. It takes 5 units, y'all, which is a tiny amount, but it really makes a huge difference. And for a lot of people, do your whole face, that's still their favorite. It's a small one, but it's just really good the way it helps lift. The chin texture, when it gets kind of pebbly, you're basically seeing the muscle underneath, and you can put some in it, and it just relaxes the texture. So one use is to relax a muscle. But sometimes when you relax a muscle, you get texture changes that are just really pretty. And then the neck. The neck is great. It's Jan's favorite is the neck. And it really will tighten. And no matter what anybody tells you, it works. I don't know why people want it not to work. I do facelifts and can always do a facelift, but if you don't quite need one and you have a few lines, or you're young and you're starting to get tech neck, there's really nothing like putting this in it. So we actually use Dysport in this one. Longevity. Love it. We all have a great day. Let me know if you have any questions.